It's time once again for a sponsored segment on First at 4 we call Medical Monday. On most Mondays, I talk to one of our sponsors from the medical community about the services that they provide. And my guest today on Medical Monday is Dr. Jim Link from University Oral and Facial Surgery. Jim, thanks so much for being with us today.
Thank you for having me.
Absolutely.
Appreciate it.
My pleasure. Let's just go ahead and get right to it. Tell us about your practice and what you guys do.
Well, I've been in practice with 3 other surgeons. Initially, I came to town in 1991, started my own practice, and in 1998 merged practices with Ron McWayne and Terry Carlson. And about 6 years ago, Craig Fairburn joined our group. We have a group practice in oral and maxillofacial surgery. And most of our surgery is done in our office, although we do operate at both DCH and Northport Hospital on occasion.
Now, what exactly is oral surgery? A lot of people think, they start thinking about teeth or thinking about dentists, but that's not necessarily the case, is it?
Well, no, it's not, but although we are a specialty of dentistry, we go through dental school and have a dental degree, and then we do a 4 to 6 year residency in a hospital-based setting typically, where we receive training in treatment of facial injuries, facial pain, TMJ disorders, people that have mis- or malaligned jaws, we treat those. And we treat pathology, oral cancers, cysts and tumors of the facial structures as well. And we do dental implants, and we've been doing those for 21 years now here in Tuscaloosa.
Wow. So I guess you've gotten pretty good at it.
Well,
that
I like to think so, yes.
All right. And some of the things you mentioned are things that dentists, pretty commonly do, like pulling wisdom teeth, the implants, stuff like that. Why do dentists oftentimes refer their patients to an oral surgeon?
Well, I think it's very much up to the discretion of the dentist, and some dentists have more experience than others. Some don't feel comfortable doing certain complicated surgical procedures, and we obviously do because we have our 4 years of additional training minimum. We have some dentists that refer every patient that does require surgery, and others that don't refer very little except the most complicated things. So it's pretty much up to the discretion of the general dentist that you see.
There you go. You guys handle the more intense surgeries daily, whereas the dentist would probably only encounter something like this maybe once a month from a patient at the most, or I don't know, ballpark that for me.
That sounds about right, correct. Yeah,
absolutely. All right, well, how can we find out a little bit more about what you guys do over at University Oral and Facial Surgery?
Well, one of the things that I think that we like to do, when we treat our patients, is we do look at their whole problem, and sometimes because of our surgical training, we can present options that either the general dentist may not have or may not be aware of. And we feel it's best for patients to be treated in a team setting where we would work with a general dentist and a surgeon like ourselves, and also some other specialists like an orthodontist or even periodontist. So those are different specialties of dentistry. So that's our main goal, and we always communicate and keep in touch with the general dentist. For instance, there are some advanced procedures now, like the all-on-4 procedure on dental implants to replace dentures, that up until a few years ago, we weren't able to offer this type of service, but now due to CT scanning technology, we're able to find bone where otherwise we couldn't have found bone, and basically immediately place implants and restore people to the full complement of their teeth in one day. So it's very exciting and works out real well. So we're available anytime, and you don't have to have a referral to see us. However, we will communicate with your dentist to make sure you get the best possible care that you can.
All right, yes, sir. Jim, we're out of time, but thank you so much for being with us.
Thank you.
Yes, sir. If our sponsor sparks your interest today, you can give them a call down at University Oral and Facial Surgery. The number is 205-556-2323. You can find out more about them online at uofsdocs.com.